Myself, Dr. Jyotirmay S Hegde. I am the lead consultant and head at Department of ENT, Aster Hospital, Whitefield. So the topic I'll be talking today is regarding allergic rhinitis, which is a very common topic in this part of the Bangalore, and it's very common throughout India as well as world. So what the common symptoms of allergic rhinitis? The most common symptoms what we see in allergic rhinitis is recurrent cold, runny nose, sneezing, itching in the nose, eyes, throat, and associated there may be stuffiness in the nose, nasal blockage, headache. So when should we address or consult the ENT surgeon or a consultant physician whenever you have any allergic rhinitis? If it is disturbing your day-to-day life, if the allergic symptoms are too severe and bothering your day-to-day life, it is causing disturbance with the work, or you are having other symptoms like nasal blockage, significant sneezing, itching, cold, these are the areas or the symptoms when you should go and approach your ENT consultant. So how do we manage allergic rhinitis? First of all, it needs an ENT examination to make out whether it's really an allergic rhinitis or there are other forms of rhinitis which can also mimic like allergic rhinitis. Once we examine and then we feel that it's allergic rhinitis, there are some tests like common blood tests which are done to know whether it's an allergy. Most common gold standard thing which is done to know about the allergy test is something called as skin prick test, which is also available at our Aster Hospital Whitefield. Once we do the skin prick test, we can know whether it's a specific allergen or a non-specific allergen. If it is something like a specific allergen, then there is immunotherapy to treat it. So immunotherapy is basically building your immunity against the sensitive allergens, which in the long term can help to cure the allergy. So earlier, what was done something called as subcutaneous immunotherapy, which is called SCIT, but nowadays we have sublingual immunotherapy, which is nothing but SLIT. So with these therapy and the medical line of management, it is possible to control the allergic rhinitis and sometimes even cure the allergic rhinitis. However, if there are added mechanical factors, there is nasal blockage, significant sinusitis because of the bend in the in the nasal septum, it's called deviated nasal septum, or there is bogginess in the airbags, what we call it as nasal turbinates in medical term, or there is significant sinusitis, you may require surgical line of management as well, for which require certain investigations like X-ray of the nose and the sinus, or in some cases CT scan of the nose and sinuses. And when we find out how much is the bend and how much is the extent of sinusitis, you may require some surgery as well. So this is in brief regarding how we manage allergic rhinitis. For any further queries or any clarifications, feel free to consult us at the ENT department at Aster Hospital Whitefield. Thank you.